Hello and welcome. This is Healing with Traveling Treasures. My name is Taryn.
And I am Tori. We are here today to talk about caregiving in the professional setting.
Both of us have spent quite a bit of time working as CNAs in nursing homes and assisted livings and various situations. And we just wanted to share some of our stories and our experiences with you so that you know what it's like to be a caregiver and also give some advice to people who might be caregivers and are in tough situations right now. So, Tori, could you please give me a little bit of a background about when you started becoming a caregiver? Because you got into it a little bit before I did.
1999. It was that long ago. 1999. So, I had separated from my husband and moved back in with my mom. It was going to be a temporary situation. And at the time, I had no real experience for like a career type thing. I hadn't gone to college or anything. I spent my teenage years working in retail and restaurants, so I had that. But I needed something that was going to be enough to take care of my daughter because she was like 3. And so when I came home, I was looking for jobs and I found an ad in the paper way back when they did that.
That dates us a little bit, doesn't it?
But
Newspaper, like actual paper, classified
actual
ads. You're looking like,
classifieds, yeah. So I found an ad in the paper for a nursing facility that was offering free CNA classes, like on the job, where they would pay you to learn and teach you on the job. So I applied for it and I got in and I was kind of excited because now I'm gonna learn some actual skills and get paid for it. So it was amazing. And my teacher, Jody, she was absolutely amazing. I freaking love her. I still talk to her once in a while too.
do
Um,
you? I like Jody
I
too.
do.
With
She
the red
was,
curly hair, Jody?
yep,
Yeah, I
yep,
remember her.
yeah. But that's how I got started.
I worked for all kinds of technical support jobs. I was doing office jobs and working in a cubicle and answering telephone calls and hating every minute of it. And when I got fired from my last job in 2001, it was right before 9/11 because I
Oh,
remember watching those towers come down
mm,
and thinking about how the whole tech industry took a big huge dump. And
yeah.
I said I would never answer another phone call again.
Hmm. I don't
I
blame
didn't want to do it. No, I'm not going to sit in a cubicle anymore. So I took half the pay to go up to the nursing home
Yeah.
where I found a program too where they gave you free training to
Hmm.
be a CNA. And I said, all right, well, I'll go check this out. And I went through the training process and took the test and got my certification to be a CNA and started working at the same nursing home where you were.
You did, and I got to train you. That was fun for me because by the time you started, I was a preceptor,
Right.
which I loved. I love, not everybody liked being a preceptor, but I loved it because um for one, I was going to be working side by side with all these new CNAs, and I wanted to make sure they were doing everything correctly. I
Right.
wanted to make sure they were taking very good care of my patients because I loved my patients. And I'd seen people who did like shortcuts that were not good. I
Right.
mean, some shortcuts can be okay as long as you're still doing everything right,
Right.
And but
Well,
I
as long as the individual who's receiving the care feels cared for
right,
and has the things they need to be safe and healthy and happy and
right.
clean and
Yeah.
comfortable, right?
Yeah.
So if you're taking shortcuts, like you're you set up all the beds before dinner,
Mhm.
that's a shortcut you can take because you know you're going to have to do that later on anyway.
Mhm.
But
Right.
having that ready for you for when you end dinner and you have to move everybody down, that's a
Right.
step that you take to prepare for the next thing.
Right. One of the shortcuts that I couldn't stand that I would see is people who would not use gloves
Oh, I
because
know.
they were like, "Oh, it takes so long to get those gloves on and sometimes they don't fit well, or I just washed my hands and my hands are wet so I can't get them on." Or they wouldn't wash their hands at the proper times. And it's
Right.
like for me, infection control is so important.
Paramount.
especially with this population, because they're already have enough ailments going on with them. They don't need somebody else's germs, including
Correct.
yours.
And
And
the other 5 people you just touched before them.
exactly, or you just took a diaper off of them and gathered it up and threw it away, and now you're going to go clean them with your dirty hands. I mean,
Or you're going to go
makes
feed
sense.
somebody else. No, I'm like,
Yeah.
yeah, I have a really hard time with, I still think about that to this day.
Yeah.
Even, with my own hands, what
Mm-hmm.
did I just touch? And do I really want to put that in my mouth or in my eye?
Right.
Like
Right.
I know I just touched that door handle where 500,000 other people just
Mm-hmm.
touched,
Yeah.
and all those germs are transferred to my hands. And I think
Mm-hmm.
about that all the time, that,
Yeah.
that training that we had with the hand washing was really
Mm-hmm.
important.
Yeah. I
And
still wash my hands constantly.
cross contamination, thinking
Yeah.
about,
Mm-hmm.
taking, when I'm working in the kitchen and I'm working with chicken, I'm really careful about making sure that I don't touch stuff that I just touched with my chickeny
Right. Or
hands.
even using the same knife on your chicken as you do on your vegetables, or you know what I mean? It's
Right.
like
But
do the
being a
same stuff
CNA
for
made me
everything.
even more aware of that. I was just really
Yeah.
aware of, like,
That's it too. When you're a caregiver, especially in a nursing home, you are literally doing everything for them that you do for yourself. So you get them up in the morning, you help them wash up, you give them showers, you take them to the dining hall, you
brush
feed
their
them.
teeth.
Yeah, you brush their teeth, you wash their face and hair, you wash their feet, everything. And then so, it's not just one or two things that you have to get used to doing. You're doing literally everything. So, that cross contamination can go so far,
Right. I just want to talk for just a minute about what training is like. So they have a two
Yeah.
week training course at the nursing home that I took, and they taught us about how to do the hygiene they were talking about, to clean your hands, to keep wearing gloves, to not cross contaminate things between one person or another, how to change the sheets in a sanitary way so that you're not like flopping the sheet and throwing the germs all over the room, that you're unfolding the sheets in a certain way. We were taught how to make the bed in a certain way. We were taught how to dress people. We were taught how to address people.
Hmm.
And so you had to come into the room and introduce yourself and explain what you're doing. Because if you have an older person with some dementia and then you have somebody coming at them like, what the heck is going on here? Why are you taking my clothes off? You
Right.
need to
That could be
you
very
need to be able to
traumatic.
explain, right? My name is Taryn and I'm here to help you today.
Right. Right.
So that will kind of put your mind at ease. And
Hmm.
we were trained on all of those things in 2 weeks,
Hmm.
which is not really enough time to take in everything that you have to take in. And then we
Right.
had to do clinicals where we followed
Hmm.
around somebody. So in this case, Tori was one of my trainers. We happened to be best friends, but she was there already and I got the job. And then she had to be the one to teach me how to take all those skills that I just learned and apply them to the people in the hallways.
Right.
How to
Right.
get all that work done in a certain amount of time,
Hmm.
how to make
Yeah.
sure that
I
nobody's out there waiting too long, or
Right.
um
Getting people to breakfast on time, which was
right.
quite the task because you have a certain number of patients that you have to, or residents in the nursing home, you call them residents.
Well,
So,
and just to tell you, it was between 12 and 14 people every day to get them up, put their clothes on, and get them to the breakfast table in
right.
time every day. 12 to
And
14 people.
also, on top of that, like those 12 to 14 people, some of them needed more help than others. And it was
Right.
your responsibility to help. What they used to do is like there's this thing called the dysphagia, and that is where you cannot swallow properly. And rather than it going down your esophagus, it would go down your trachea. So then
Correct.
you're aspirating, you're choking, and it's very dangerous because they can get aspiration pneumonia. And
Correct.
so they would sit at a dysphagia table, and one person would be assigned to that dysphagia table. And now it's your sole responsibility to take care of all those dysphagia patients. And then you're sitting in the middle. It's two circles, half circles put together so that you can sit in the middle. And so you have access to all these people around you, and you're feeding them and you're helping them take drinks, and it's all thickened liquids and pureed foods. And it's also your responsibility to know how thick to make each person's drink because they all have
Right.
different levels. And
The
it's
way
your
it was explained to
responsibility to
me is
do
that
that.
the esophagus
Hmm.
shuts off when you're trying to swallow food, and the food should go down into the stomach, right?
Hmm.
What happened with dysphagia, there's a little gap, and
Hmm.
so the food is able to get down into the lungs, or water is able to get down into the lungs instead of flowing down into the stomach where it's supposed to go. So thickened liquids, it helps it flow over that gap and down into the stomach, and so the person doesn't choke so much.
Right.
But they also have pureed foods. The food is like baby food
Right.
consistency. And what they would expect us to do is feed 6 or 8 people
Hmm.
that have the same condition,
And you
and you have
have to
to
keep their
turn
glasses
around and
away
feed the
from
guy
them, out
behind
of their
you.
reach,
Right. You have to keep the
because
liquids out of
they
their reach
can't
because
do
they,
it by themselves because they may do it too quickly.
right.
And
And
so
then
you have to
choke.
monitor that too.
Right. And then on the ambulatory Alzheimer's unit, you've got your buddies who want to
Hmm.
jump up and down and run around and go cover themselves in
Everywhere.
pureed foods,
Yeah.
and shenanigans happen, because they're a little bit out of their gourds, and
Yeah.
so they eat their pureed food really fast, and then they take their bib off, or they take their shirt off, and they go lay
Yeah.
down in someone else's bed. You have to cope with things like that, and you have to cope with things like, well, so let's go back to the training bit of it
Oh,
again, because that's
yeah, yeah.
kind of what we were talking about. Um, we were talking about training and how you had to help me learn how to do those things, and how to help
Mhm.
me learn how to be
Compassionate.
efficient and compassionate.
Hmm.
Efficient, though, too. Like, not
Yeah, yeah.
only doing
I
it
mean,
with
you were
love, but
already
doing it
compassionate, but not everybody is when you go in there. Not everybody has common sense either. So you have to kind of teach that as well.
right. But you have to be loving and fast,
Yes.
because Betty's waiting, and so is Sandy, and so is Joe, and so is Georgia, and they're all sitting in the hallway, and
Hmm.
they all need help. You've
Yeah.
got 14 people that need something.
Right. And not only that, on top of all that, you have other tasks that you have to make sure you do in certain time frames, like
Right,
vitals and charting. But there's a lot of things that you have to do literally all at once. And you
right,
only have a certain amount of time to get all this stuff done,
correct.
which is where the efficiency comes in.
Yeah.
Hmm.
Man, so many challenges. What do you think was the biggest challenge of working for a nursing home? What was the hardest part?
The hardest part for me, probably dealing with family members. Yeah, that was one of the hardest because some of the family members that would come in, I love them, but they wanted my one-on-one attention for so long. And it's like, I have so many other patients to take care of. I don't have time to sit and talk with you for 20 minutes. Not
Hmm.
because I don't want to, but I literally
Right.
have other things to do.
And Betty and Sandy are all waiting in the hallway while I'm sitting here bullshitting with you. They're all sitting there
Exactly.
waiting.
And not only that, other family members would come in and be very angry about something or very confused or upset about something and want answers right now. And they want results right now, and
Understandably, because it's their loved one, and
oh,
their loved
yeah,
one is sick or hurting
yeah,
or whatever, uncomfortable.
absolutely. So you have to coach them and you
Right.
have to help them understand why this is being done this way. Or you have to work with them to find new ways of doing this or that
A
with
better
their
solution.
family member because it is important. It's important to them, it's important to the family member, and therefore it's important to me. Oh, and sometimes that's really difficult, especially with the ones because there are some that you just can't please.
Right.
So you have to learn how to talk to them in a very respectful way and a very effective way, so that they leave feeling at least a little bit better than they did when they came in.
Right. You have to validate their concerns, and you have to meet
Absolutely.
them where they are. Like,
Mhm.
some people have a lot of information and they have a lot of knowledge. They've been through this before. They know what it's like to go through,
Right. Yeah.
a nursing home or whatever. And some people have never experienced
Right.
anything like it. They don't know what it's like to turn over the care of their loved one to a
Right.
facility. And,
And they feel bad about it. A lot of
oh,
them have so
sometimes.
much guilt.
However, I learned in the nursing home that some people
Hmm.
were not kind to their loved ones, were not
Hmm.
kind to their children, did
Hmm.
not take care of other people,
Hmm.
and they wind up alone in the nursing home.
Right. Yeah. There's so many. And you know what? Not only that, like there's so many families that won't come and see their family member because it's hard on them because this is not the person that they knew,
Right.
especially the Alzheimer's patients or the dementia patients, you know, their daughters would or their sons would say, "This isn't my mom. I had to say goodbye to my mom years ago because this isn't her,"
Right. But it
and
is still her.
yeah,
And
but
the thing
he
is,
doesn't
people don't,
like right, and that's really hard for family to accept and to deal with, which is really sad because this person still needs you, and even though they may not know who you are, they still need you.
well, I discovered that the feelings still very much exist
Oh
too.
yeah.
If you have
Mhm,
someone coming toward you and giving you love and compassion, whether or not you know that person, those
mhm.
feelings, those hormones happen in your body.
Right,
They happen in your mind. You
right.
feel the love and the comfort and the
Mhm.
companionship,
Right.
and all that sticks with you even though you don't remember the
Mhm.
person's name. Those
Right.
chemicals come into your body and come into your mind.
Yeah.
And people had a hard time understanding that. But we had to do a lot of education too. We had to
Oh
educate
yeah.
people about the
Yeah.
disease and about how
And the process of it and why your mom carries this baby doll around and insists that it's you,
right,
this is my daughter, my daughter so and so, and you're like, no mom, that's a doll. I am your
right,
daughter. And they're like, my daughter is a baby. And they truly believe that in their mind because that's where they are
right.
at that moment. But then they can have other moments where they recognize that this is my daughter and oh, but those
The
moments.
term that we learned in training was validation therapy.
Right.
And that's where someone has their reality. Their reality is
Yes.
that they're 24 years old and they're living in
Mhm.
1944 and they're driving off, an old car,
Mhm.
and they have to get a job.
Yeah.
And their reality, you think about that, how you feel about yourself right now.
Mhm.
You are who you are. And if someone comes along and says, no, you're not,
Right.
you don't need to get a job. You're old. You live in a nursing home now, and
Mhm.
that's not your reality.
Right.
It is jarring. It's like, can you
Very.
imagine how
Yeah.
confusing and scary that would be?
Mhm.
And so they trained us to kind of roll with it.
Yeah.
If someone comes up to you and says, I need to find the keys to my truck,
Mm. Yeah.
you can say, well, the keys are locked up right now. I can't get to them right now, but
Mhm.
I'll get to them later. Can I get you some hot chocolate right now, and try to redirect the
Right.
person from what they're obsessed about?
Mhm.
Like they can't have the keys to their truck because they have Alzheimer's and they haven't driven in 10 years, but they don't
Right.
remember that.
Right.
All they remember is that they need to get that job done. And you know what that's like, to
Yeah.
have to get your keys and get on the road to get
Yeah.
down,
You're
do
late
the
for
next
work.
thing.
Oh my God, I'm gonna get fired.
Right?
Yeah.
So validation therapy taught us to validate that person. But
Reading. Read is huge. You
right,
have to know how to effectively redirect these people because, this is what's on their mind right now. Okay, let's have breakfast. Breakfast is the most important meal of the day. You're not going to get through your workday until we have breakfast.
correct.
So we go and we have breakfast, and by the time they're done with breakfast, they're on to some other task. They're in another part of their life, you know.
Right. I had a lady that was always looking for her husband who had passed away years before.
See,
She
and
was
that's,
looking for him, and she would
yeah.
come up and say, "Have you seen him?" And I would say,
Mhm.
"No, I haven't seen him around, but I'll keep an eye out for him." And
Yeah.
just saying that to her made
Yeah.
her feel better, like, oh, "Okay, I've got one more person on my side."
Right. Or
Whereas if
you know
I
what?
had
He's at
said,
work right now. He'll be back a little later.
right,
We'll keep
but
an
if
eye
I
on
had told her every time, "No, Mary, don't you remember he died?" She would go
She's
through
gonna
that sadness every time.
yeah, she's gonna relive those moments of when she lost her husband because to her this just happened. If
Or
you
at least
tell her,
feeling scared that she's forgetting things,
mhm.
or that her mind isn't working right, or
You
whatever.
know
Like,
what?
you're
That's another part too, is with Alzheimer's, it's kind of a slow progression. And think about it, because in the beginning, it's like that you're forgetting things. You know that your life is changing and that your memories are changing and you know that you're not going to get better. And that is terrifying. If I wake up one day and I don't remember that I have a daughter, I think it's 1980 and I don't have a daughter. I'm too young for that. And my daughter
right.
walks in, and then a little bit later, I'm like, oh, yeah, you are my daughter. You've grown up. I took care of you. And that's terrifying because you're like, a minute ago, I couldn't remember that. I thought I was 18 and in high school.
That part about the modern daughter fades away,
Mm-hmm.
and all you're left with is 1984
Right, right.
and the songs you knew in
Mm-hmm.
1984.
Right.
You know, it's so tragic and so hard to deal with.
It really is. And
But
just helping people through that process. And another part of too, the nursing home is not just Alzheimer's. There are different levels. There's the long-term care where people are completely with it. They don't have the dementia, they don't have the Alzheimer's, but they, their
have
health has,
diabetes or
yeah, their
something.
health has gone down to the point where they need a little extra help. So
Right.
they're basically living in an apartment or a dorm upstairs. And, they come out for breakfast. They know what they're doing. Maybe they need a little bit of more help in the shower or just reminders, to, what, oh, it's time for breakfast in about 15 minutes, make sure you get there, that type of thing. And then there's the rehab floor where these people have been through some dramatic incident with their health, like a surgery, heart attack with bypass surgery. They fell and broke their hip, so they had to have that surgery, or they had a
Amputations.
stroke, and now they have to, rehab from that.
Right.
And those are sometimes can be really hard patients to take care of too, because one, maybe they're pissed off that they're in the nursing home. They know that this isn't where they want to live and this isn't where they belong, but they have to be there until they are able to take care of themselves at home again. And
Right.
sometimes they don't get to that point and they just end up staying at the nursing home for the rest of their lives. And that's hard too. A really hard part of going to live in a nursing home. Think about this too. Joe has had his home for the last 50 years and he's taken care of his family and he's worked really hard and he's gained all of this stuff. He has the car that he always wanted or the truck that he loves, and he has his furniture and he has his pictures of his family growing up and all of this stuff, and now he has to compact that into one room.
Right.
And a lot of times half of a room, because people share rooms. There's two people to a room. So now they have half a room that they can furnish with their own belongings, and they've had to get rid of or leave behind almost
99%
everything
of
that
it.
they
Right.
own.
Right.
And not only that, they're also giving up their independence, and it's not
Giving
by
up
their
their
choice. They're being told by their doctors, no, you cannot go back home. And that's it. Bam. Think if somebody walked in one day and told you, you know what? This is a lovely home, but you can't come here anymore.
right. It would be devastating.
Grab
And
what you
then
can
to
and
to
go.
wake up in a new place every morning.
Mm-hmm.
I had one patient that I would put to bed and
Mm-hmm.
she would come out 5 minutes later and say, "Where's my room?"
Mm-hmm. Yep.
And I would say, "This is your room. Come on back. We're going to go lie down. This is your room. This is where
Yeah.
you're staying tonight." She would
Mm-hmm.
pop up 5 minutes later, "Where's my room?"
Yep.
And I had to go back, but it never felt like home to her. It
Right.
wasn't her familiar belongings. It wasn't her
Mm-hmm.
familiar things. It wasn't the smells and the sights and sounds of home. She was
Right.
obviously not home,
Right.
but she couldn't remember that she didn't live at home anymore. She
Mm-hmm.
lived in this nursing home.
Yeah.
It was so hard.
It was. It really was. It's heartbreaking, but I got to tell you, the rewarding parts of working there is the love and the bonds that you make with your residents, your patients,
Oh yeah.
Um,
I always felt so
holidays.
fortunate to rub elbows with people who lived 50 years before I did, who
Yeah.
lived
And
75 years before I
listening to
did.
their stories. That's
Yeah,
another thing is they
right.
have a lifetime of stories and they want to tell these stories. And so
And
to be
songs. I
able,
loved learning songs from them.
yes,
I'm
yes.
Chiquita Banana, and I'm here to say bananas have to ripen in a special way. So when they're flecked with gold and have a brown golden hue, they anyway, she
You
taught me the
remember more
Chiquita
of that
Banana
song than
song.
I do, but I remember she was the sweetest little lady. She was tiny and she loved singing that song and she loved teaching it to us. And I just,
Bananas taste the best and are the best for you. You can bake them
yes.
in a pie. You can put them. Anyway,
You
any
remember
way
so
you
much
want
of
to
it
eat
more than
them,
I
they're
do.
impossible to beat them. But bananas are a product of the very, very tropical equator. So never put bananas in the refrigerator.
Yes, I
That's
love
what I
it.
learned.
Yeah, I love that. And I loved holidays with them because we went all out. We would decorate the whole facility, we would decorate their rooms. We did activities with them. Like on Halloween, we have a costume party and we got to dress up our patients and we dressed up
Right?
ourselves and we'd have a big old Halloween party and we did trick or treating. So all the kids in town would come and trick or treat, and like all the residents would be lined up in the lobby and down the hallways and wherever we could fit them, and they'd be in their costumes, and the kids would just come through and go stop at each one of them, and they'd give them a little piece of candy, and
That's some
they
kind of cheating trick or
loved.
treating, though.
It
Remember how
is,
far
but
we
you know
had to
what?
walk? Remember
I
how
know,
far we had to
right?
walk in the snow, uphill both ways, barefooted with the bear
Barefoot.
chasing us to get our candy?
Yeah,
Kids these days, they just go to the nursing home, be like, hey,
right.
hey,
Yeah.
hey.
Oh my gosh. And elderly people in the nursing home love to see children. Love it. It is
Kids
so
and dogs.
watching their faces light up when they
Yeah.
get to interact with children or when they get to do something that they used to do for holidays, like at Christmas time too. We would have, Thanksgiving, we would have a Thanksgiving meal for them. Christmas, we would do gifts for them. We'd have Santa Claus come. We just did really cool things for them on holidays. Easter, every holiday we would do something with them and for them, and that was my highlight.
Well, I was the bus driver at Life Care for a little while, at the
Word.
nursing home for a little
Yeah.
while. And
Oh,
I what yeah.
go ahead. I think I know what you're gonna say. Go ahead.
Well, I used to take them out for Christmas lights
Yes,
at Christmas
I
time.
knew that's what you
And
were
we
gonna
would go
say.
around town and find all the best Christmas lights, and we mapped out a route, and then
Yes.
we would fill the bus full of all of our residents, and
Hmm.
we would drive out to go see the Christmas lights. And it was such a neat time because I would play Christmas music, and we'd
Yeah.
have some hot chocolate on the bus, and we'd go driving around and go see all the lights, and they would judge people. I think that one's the best one we've seen so far tonight, or that one's really cool because I like the polar bears or whatever. And
Yep.
it was really fun to
Ooh, I
go.
remember the polar bear house.
The polar bear house is
It
spectacular, isn't it? It's one of
is,
my
yes.
favorite.
Do they still do that, I wonder? I mean, it's
Every
been
year.
years and years.
Every year. They're still
Nice.
out there.
You know what else?
And
I
so is
love the
the
Disney
Disney
one
house.
too. Yep.
Yeah, the Disney house is
Yeah.
still down there and doing
Yeah.
great too. Yeah.
So speaking of doing special things and things like that, um, one of my favorite stories. Okay, so I had this patient. I'm gonna call her Beth. Okay, so when I first started, when I was a little baby CNA and learning,
Beginner we think, yeah. But then
yeah,
we
um, it was my first time getting a person up in the morning and helping them to get to breakfast by myself. And she was my only patient that day that I had to focus on. And they said, okay, she's pretty easy, just go in there, explain what you're doing, da da da. So I go in there and I introduce myself. Hi, Beth, I'm Tori. I'm here to help you get ready for breakfast. Let's have a great day today. And she's there with her covers up like this, and she's looking at me. She's following me with her eyes, and she looks at me and she listened to what I had to say. And then she says to me, you're a cockroach. And I was like, okay. I wasn't sure how to take that. And I was like, all right, cool. I'm a cockroach. Why don't we sit up? And I said, I'm going to pull your covers down so I can help you sit up. And I went to pull her covers down, and she started trying to beat the hell out of me. You
And see all the other girls in the hallway are probably like, check this out. Watch
Yep,
this. We're gonna
yep.
send her in there to talk to Cockroach right now.
So
I
he
had
would let
Scary
me touch
Mary.
her.
Scary Mary, when I
Uh-huh.
went to go take care of her, my job was to shower her. And so
Mhm.
I would tell her it's time to go take a shower, and she would say, I don't want to do that. And she would scream,
Mhm.
don't hurt me! Don't hurt me! As she's wailing
Well,
on me and pulling my hair and
yeah,
pulling my shirt off and
that's
screaming
exactly
at me,
Beth too.
don't hurt me! And
Yep.
she's
But but Beth, instead of saying "Don't hurt me," she's like, "You're killing me! You're killing." And she would be beating me, and she would be scratching. Oh my God, she would scratch the hell out of me. She hated showers. She never let anybody give her showers. Well, throughout my time, I just kept going in there and I just kept talking to her and everything and helping her with things. And I was just, compassionate, and I just would validate everything with her, you know.
right.
And it got to the point where her and I had this bond, and she loved me and I loved her. And it came to the point where I was the only one that could give her a shower without getting the hell beat out of me. And her and I would sit and talk. She told me all about living in different countries, and her favorite place was Peru, and I need to go to Peru any chance I get. And to this day, I want to go to Peru because of her.
Let's go
Um,
to Peru. Let's
Heck
get our
yeah, we're
passports.
gonna
We're
do
gonna do
it.
this
We're
thing.
gonna do it.
Okay.
But anyway, so well, it was the 10-year anniversary of that nursing home. And so as a celebration for the anniversary, the nursing home was putting on a luau. And so we cleared out the front parking lot of all the cars, and we took out all the tables from all the dining rooms. We put them out there with the chairs, and they roasted a pig. We decorated, we had like palm trees, we had lights, everybody got leis. It was amazing. And the goal was to get every single resident out there. And we did. So first of all, Beth never wanted to do anything but lay down in her bed. So, in fact, after meals, we'd put her in the lobby so she could have everybody watching her. Well, she would sit there in her wheelchair and she would sing this little song, "Put me to bed or I'll chop off your head." And she would just sit there singing it over and over and over again. And she'd be facing the elevators. And everybody that walked off the elevators, "Put me to bed or I'll chop off your head."
Funny.
Yeah, so when it came to the luau, she did not want to go. She was like, "Nope, I'm not going. I don't want to. I don't have to. You can't make me." She was literally the last one to leave the building. I had already tried a couple times. Everybody had tried at least 5 times. And so I go up there the last time and I said, "You know what, Beth? My family's here, and I would love for you to meet my mom and my daughter and my dad. Would you please come down at least for a little bit and meet them? And if you want to come back up, that's fine. I'll bring you back up when you're ready, but please come out." And so she finally agreed, reluctantly, so I was excited. Took her down there, and I sat her at the table next to my mom. And she started talking to my mom. I brought her some food, and she sat and talked with me and my family the whole time, and she absolutely loved every minute of it. She kept thanking me for bringing her down and for introducing her to my family. And at the end of the luau, when we were taking everybody back inside, she didn't want to go. She's like, "Nope, I'm going to stay right here." We got everybody else back into the building. We cleaned up the entire parking lot. We took all of the tables back inside. Everything was completely cleaned up, and she still didn't want to go inside.
When she came out to party, she was ready to party. She was like, I'm just going to
Yes.
stay here until the sun sets and the
Yep.
cows go home. And
Yeah.
then I'll go home maybe if I feel like it.
And so I finally got her to go in, and I was bringing her upstairs, and the whole time she was like, Oh my God, that was so much fun. Oh, I love your mom. She's so sweet. She could not get over my mom. She loved her so much. She just was on and on about how much fun she had and how great the food was and the music and everybody and the decorations were beautiful. And so I took her up and I, got her settled and got her to bed and she was just happy as a clam. And the next day she passed away.
The next day?
The next day. And I wasn't at work the day that she passed away. I came back the following day and I was like, "Where's Beth?" And I was absolutely crushed.
I bet.
I was
bet you
crushed
were.
not just because she passed away, but because I wasn't there with her in her
Right.
last moments.
And you had been there all that time. That's all right. You threw her a big party. She checked out. It's all right.
I tell you what, she went out happy.
Yep, there you
She
go.
went out happy.
I'll never forget our favorite cowboy too, Clarence.
Yes. Yeah.
He used to come up to the desk every night and be like, "I'm looking for the keys in my truck.
He was the
I got to go home and feed the
sweetest,
horses."
sweetest man.
He was so sweet.
And he was
But he
so
hated
smart.
taking a shower.
He
Hated
did.
taking a shower. I had to be like, "Hey, Clarence, it's time to go take a shower." And he'd be like, "I don't need a shower." "Clarence, do you see that nurse over there? If I don't get you in the shower right now, they're going to fire me, Clarence. They're going to fire me faster than ever. Clarence, please help me take a shower." And the nurse would be like, "Taryn, you better get him in the shower now or you're out of here." He'd be like, "Okay, well, I don't want you to lose your job." And then he would get in there and he'd do everything for himself. One time he was sitting at the table playing bingo with all the ladies, though. And he looked up and he laughed. And the lady that was calling bingo, she said, "What's going on, Clarence?" And he said, "I just saw an old friend who owed me money." And then he died. He had a heart attack and died.
Right there.
I just saw an old friend who owed me money.
It always fascinated me too. When someone was about to pass away, they would see people and they would talk to people that were obviously years gone. I've seen people talk to their husband, their children, their grandparents, their parents, their cousins, their best friend,
Oh,
And
my
it's-
grandfather was in a room full of people when that happened.
yeah.
He was having terminal agitation, which is where they say within the first like 24 hours or so before a person passes away, they have this little burst of energy sometimes.
Yeah.
And my grandpa was shaking the bars on his bed. "I want to get up. I want to get up. I want to get up." And I knew if he got up, he would be so weak. And I helped him
Yeah.
up anyway, helped him up into a little chair and I sat him there and he was looking around and all of a sudden he goes, "Who are all these people?" And I said, "I don't know, Grandpa. Who are they?" And he said, "I don't know, but they look familiar." And he started to get up and I said, "Just stay here. They'll come talk to you." And he said, "Hi." He introduced himself. "This is my name. Where are you from? Are you from New Mexico? Are you from Wyoming?" And he was just he was at a party. And he said, "I'm going to go talk to that woman." I said, "No, you just stay right here. She'll come talk to you." I said, "I think this party is for you." And he just drank it all in for the longest time. And then he said, "Okay, I think I want to lie down now." And I helped him back into his bed. And then he kept saying, "Abra la puerta, open the door. Abra la puerta." "The door's open, Grandpa. It's open." "I want to go upstairs." "Okay, we'll go upstairs. It's all right. Whenever you're ready, you can go upstairs. The door's open." It was just,
Yeah.
interesting.
It is. It's fascinating watching people. And that was something that everybody always would tell me that, people from outside that world would tell me, "How do you watch people die? Isn't that so sad? How do you deal with that?" And the thing is it's not always sad. It's a beautiful process. And that's the thing about working with geriatrics and like they've lived their lives. They've had
Right.
all the experiences. They've done all the things, and now they're ready to go. And
Right.
it's such a beautiful process to just watch them, watch them see people that they've missed, watch them talk to these people, watch them, a lot of times, watch them say goodbye to people. The way that they say goodbye to us or their family members, it's a very subtle way. And sometimes people don't know that that's what they're doing, but
Right.
that's what they're doing. And it's to be a part of that. And then also, to be able to comfort them as they go and to be
Right.
there for them, especially in their last moments. When you watch somebody take their last breath, yeah, it's heart-wrenching because you love this person and you don't want to have to miss them. But at the same time, they're going to a happy place.
Correct.
They're not
They
gonna
are
suffer
in
anymore.
this place, they're suffering, their body is
Mhm.
finished, their mind is finished, they are
Yeah.
so tired, they are
It
exhausted, right? Can't enjoy life the way they used to enjoy it. And it's time to go back to what's rewarding as a caregiver is to see
yeah,
somebody who benefits from the actions that you take. You
right.
know, like I bathed this person and now they are comfortable and they're
Mhm,
happy and their family is comfortable because they look good. Their loved one has
mhm,
received the medication and the care that they need to be
mhm.
in a safe place.
Right, and
And
it's to me, it's an honor to be able to take care of people at the end of their life. It's an honor to be able
absolutely
to, once they've passed, clean them up and you dress them and you position them so that when their family comes in, they look peaceful,
correct.
and it's not such a harsh thing, you know. It's an
I
honor
still
to me.
remember very vividly the first person I had to help after they passed away.
I do
The
too.
first time the CNA came to me and said, "Okay, this is the situation. This lady has passed away, and
Mhm.
we need to go in there and change her gown and dress her and everything, and I need your help to do that." The first time I had to help dress someone who had passed away was really meaningful and poignant to me that I would be the last one to touch them before they saw their family or before they saw their, funeral home or whatever.
Yeah.
It was important to me that they be clean and they be, positioned well, like that
Mhm.
they look nice,
Yeah, I
before their
used to
family came
like
in to see them.
to I did all of it, and then I liked to make sure that I was there when the funeral home came to get them. I helped them put them in the
Transfer the
bag,
person to
transfer them
the
to the gurney, and even take
right.
them out to the hearse.
I did
I
that
wanted to
too.
be the very last one before everything. And then my first one that I had to help, I was getting her up in the morning, right? And everything was as it always had been. And I had her sitting on the edge of the bed and I got her dressed and I got her ready to get into her chair. And then I go to transfer her to her chair and literally halfway to her chair, dead weight. And I was like,
Oh,
oh my God, oh my God, Vivian. And I brought her back to the bed and I sat her on the bed and she was and I, laid her back down and tried to wake her. And I'm like, she's not waking up, catching her pulse, checking her breath. She was gone. She
oh
was
wow.
gone. And so, of course, I ran out and I told the nurse, and they're like, okay, go clean her up.
Oh my gosh.
That was my first time. And it was right after I had been released to do work on my own.
Right.
I think I had
Did
been
anyone help you or did they
Yeah, yeah. There was another CNA there that came to help me, because she knew it was my first time, and she was like, "Okay, we're gonna do this. We got this." And she, of course, I knew how to do it. I just hadn't applied it before. She helped me, and it was hard for me. I was crying at the same time because again, I loved this person, and it was my first time, so I cried a little bit, but
normal? That's normal.
yeah,
That's actually, I think, really healthy
yeah.
when you have a connection to a person and you understand that they're coming to the end of their life and that you're there in that moment. I
Mm-hmm.
think it's totally normal to shed a tear or two,
Oh yeah, oh yeah. You
But I
know,
think after a while you get kind of hardened to it too,
right.
after a while you get used to it a little
It's
bit and
like, well, for me, it wasn't necessarily that you get used to it. It was more that you learn how to cope with it differently.
right.
You learn how to, um, I guess, internalize it when you need to,
Mhm.
and um, you let the feelings flow later.
Right.
And the other part of that too is understanding that this is where they want to be. They're so ready and they were in the time of their life that it was necessary. And so it's not as sad for you anymore, if that makes
Right.
sense.
Yeah.
Yeah.
Yes, it does. It makes absolute sense that you're just kind of
Mhm.
it's not as sad because you have a greater understanding that the person
Right.
is old, that they're at the end of their
Mhm.
life, that they are suffering, that they're,
Mhm. And you've
not
helped them get to this transition. You've helped them
right.
transition to that point and then transition through it, you
Right.
know? So it's more of a I don't know how to say it, but it's more, I guess, natural progression, I guess. Um, Something else I want to talk about, speaking of all of that, is the different roles that you and I played in the nursing home. You mentioned that you were a bus driver. So you worked as the CNA first, and didn't you did activities for a while too, didn't you?
Yes, I worked as a CNA in the locked unit on the
Mm-hmm.
Alzheimer's unit. That's where I started, the
Mm-hmm.
ambulatory Alzheimer's unit. So we had about 22 people. It was. They were confused. They didn't know which room was theirs. They didn't know,
A lot of
whether
them
they should be
were
collecting wood or fixing the car or whatever
right,
they were doing. And they were, like in other places in their minds, and they were
right.
walking around the hallways. And one of the ladies we had pushed one of the plastic lawn chairs up to the 6-foot privacy fence, scaled the privacy fence, and was walking down the highway.
Remember that?
She happened to be She happened to be the preacher's wife. Remember, she was like
Yeah.
trucking down the highway. I'm out of here, man. She took off.
Yep. I remember that. Uh, but
We
yeah,
had all kinds
you
of
did activities for a while, and you
right. I worked for activities. Activities was super fun for me. I
yeah,
loved doing that because it was
you were
my
good
job to
at it
make
too. You were
popcorn and
so
paint
good at it.
nails and watch Lawrence Welk
Yeah.
and go on trips to the butterfly pavilion and go
Yeah.
fishing. And I loved that job, man. It was
You
so
were
much
so
fun.
good at getting people to go to the activities. Because that
Oh,
was
I
one
loved doing
thing
it.
that was sometimes really hard for some people, and there were some people who were like, "Pff, I'm not going to do that." But you
Right?
were so good at convincing them, and once they were there, they had a blast.
Totally.
Yeah.
Well, come on. There were like total fisticuffs at bingo, man.
Right? Playing
If
for
you've never
candy
worked in
bars.
a
What are you
nursing home
talking
before,
about?
you
I
don't
want to win.
understand. They played for $1 a game and you would have thought it was 10 grand. Like
Yep.
they'd be sitting there, you're cheating. You have the card with the 75 on it. The only one with the 75 on it is the only one that wins.
I
They would have
love that.
like, I would literally take the cards and the chips and dump them in the middle of the table and leave for 25 minutes while they worked out all their pecking order.
Yep.
And then I would come in and call the bingo. It was a serious
Oh
business.
yeah. Oh yeah.
$1 a game stakes.
Right.
You just never know.
That's right.
Serious business.
Yeah. I had quite a few roles there too. Like I say, I started brand new, brand spanking new. I didn't even know anything about it when I first started. And then I quickly moved into the role of preceptor. Loved, loved, loved that position. And then eventually I moved into the restorative position, which restorative, for those of you who don't know, is where basically when patients are on physical and occupational and speech therapy and their insurance runs out, they don't get that benefit anymore, but they're not quite where they need to be. So the restorative department takes over that job. So we work hand in hand with the physical therapist, the occupational therapist, and the speech therapist, and we put together care plans for the patient. The therapists teach us how to do what we need to do with these patients, how to help them learn how to walk, how to help them learn how to eat, how to help them with their, motor skills, and just different things. And we also took care of all the wheelchairs. We were in charge of assigning wheelchairs to people or bringing them back and changing them for what else they need, and fixing the wheelchairs and all sorts of things like that. So I
You
did that
also
job.
had other things though. You had walkers and braces and
All of the assistive devices, yeah.
anything like a
Hmm.
reaching grabbers
Hmm.
and yeah.
Braces, and not only that, like with the braces that we had them, sometimes they were for their hands because sometimes their hands would contract and so they couldn't physically open their hand, but you don't want your hand to stay that way because it'll your flesh will start to rot after a while.
Right, harbors bacteria. I had
Hmm.
that happen with some people where their hand
Hmm.
was permanently stuck this way.
Right,
And
and
so I
so
would
as
have to kind of
restorative,
gently
right,
pry their fingers
and
open
you want to clean
and
that area
clean the area. I would
and
put
make
a
sure it's
washcloth in there
dry.
sometimes just to help them relax
Hmm.
their hand. But you had special tools
Right.
and braces and things you could use for
Different
that.
things. Yeah, and we had to teach the CNAs how to use those devices, how to put them on gently, how long they had to keep them on. Sometimes there were other devices, like TED hose, compression hose. We had to teach them, the CNAs, how to do all of that and when to do all of that and how often and how long and all that stuff. And we had to
Right.
monitor that. We would go and do checks.
So when Tori's talking about TED hose, we're talking about compression socks. And you
Yeah.
would think it's something so simple, you just put the sock on, but it's not. They're incredibly tight
Hmm.
and they're elastic. And if you get a wrinkle in them or something like that, they can actually cut off circulation.
Hmm.
So you have to be really careful to make sure that the sock is put on in such a way that it's squeezing the whole
And there's
limb.
a certain technique to get it
Right.
in
You have
them
to
properly, which
get
is
it
also hard sometimes because the patient doesn't want to cooperate.
right.
So we also had to teach them how to deal with that and how to work around that.
They're trying to beat you while you're putting on their compression socks.
Right? Yeah. Yeah.
And then
So,
every night we'd have to wash them out and hang them up. Like
mhm.
there are so many things about caregivers that people take for granted.
Right.
So many little tiny steps that you have to do
Dentures. Knowing how to put dentures in and take them out. That's a
and
big one.
clean them professionally so that
Hmm.
they don't get sores and stuff on their gums.
Yeah. And one time I actually even had a woman who had a glass eye, and I had to take her glass eye out every night and wash it and leave it in the washing solution overnight. And in the next morning, I had to put it back in.
My goodness.
How many people know how to do that?
I personally don't. I never had to deal with a glass eye.
Yeah, I had to do that. And this lady was 105 years old.
Wow.
Hmm. And
So
she was
she deserved it.
amazing. She
She
did.
deserved the love.
She did. And she loved teasing people about her eye. She loved to scare people with it. She had the best sense of humor. She was very with it. She did not have any Alzheimer's or dementia or anything. She was in a wheelchair because she wasn't strong enough anymore. But man, that woman was amazing. I loved her. One time, it was actually the anniversary of the Titanic sinking, right? And I kind of did the math in my head, and I'm like, you were 12 years old when the Titanic sunk. I said, do you remember that? And she goes, yeah. And this was her shower day, right? So I was trying to get her up to take a shower, and she didn't want to. So I was just chatting with her, trying to kind of, get her to go. And she
Yeah.
goes, yeah, I remember that. She goes, do you think that happened because some old lady wouldn't take a shower?
Yes. The Titanic sank because your ass wouldn't get in the shower.
And she just said it with so much seriousness. I was like, oh my God, okay, fine.
That's so funny.
Yeah.
I love that. I love
Oh,
that.
oh, I have
Well,
to
if
tell
there's
you though.
anything you had to tell a new employee or a new CNA about what it's like to be a CNA and what they should do, is there any advice that you would give them?
Yeah. I would tell them, treat every patient as if it's your mother, your father, your child, somebody that you love more than anyone else in the world. Treat every single patient that way, every single minute of every single day. Because if you do that, you're giving them the care that they deserve. And
You're
don't
doing
take for granted the small things. That's what I would say.
That's beautiful advice.
Yeah.
Don't take for granted the small thing. I think my advice as a caregiver to another caregiver would be to put your oxygen mask on first, to make sure that the person who is providing care is fulfilled, is nurtured in the way that they have a, a platform or something that they can give from. Because if you have nothing to give from, you just crash.
Keep all your
You
spoons.
keep all your spoons, right?
Make sure you have enough spoons for the day every day.
If you haven't heard the spoon theory, it's that you wake up every morning and you have a number of spoons in the drawer. And for every activity that you do, it requires a spoon. You brush your teeth, it requires a spoon. You answer the phone, it requires a spoon. You make breakfast, it requires a spoon. And by the end of the day, you're out of spoons. And so the spoon theory is that you reserve your spoons for the things that really matter. You reserve your spoons for the relationships between people. You reserve your spoons for the work that has to be done or else. And you let all the other things slide for a while.
Yeah, and because you don't want to run out of your spoons in the middle of the day. And in
Right.
order to keep your spoons, in order to replenish your spoons, you have to do something for yourself. You
Correct.
have to do something that fills your cup a little bit. in
So
order
you get
to
a
earn
spoon
back a
back
spoon.
if you read a book
Mhm,
that you love for 30 minutes. You get a
mhm,
spoon back if you eat a healthy meal with like,
mhm,
vegetables and
mhm,
healthy things in it that make you feel better. You
mhm.
get a spoon back if you get a
Go
night's
s-
rest.
go spend a little bit of time outside in the sun, and enjoy the sunshine and the fresh air, you know, and kind of replenish yourself that way. You get a spoon back. Um,
Absolutely. I remember one of the lowest points of my caregiving was
mhm,
when I was taking care of my grandmother, and it was day after day after day after day after day of the same stuff, and I was so exhausted. Hospice came to take care of her for like, it was a volunteer or something that was in there for 15 minutes. And I said, okay, for 15 minutes, I get to be myself. I
right.
get to not have to worry about her for 15 minutes because she's in there taking care of her. So I went outside to the front yard and I laid down in the grass. And I remember crying and just giving it all to Mother Earth and just saying, I can't handle this anymore. Just take it from me. And just giving it all to Mother Earth and soaking in all of the sky energy. And I just walked in there feeling so refreshed after doing that. Just cleansed of all my sadness, of all my tribulations, of all my anger,
Hmm.
and just taking in the sun for a minute and feeling the healing energy of the earth was so good for me.
But it helped you a little bit. It helped you move forward with your day.
Right. So my advice to people as a caregiver is always to put your oxygen mask on first. If you're not taking care of yourself, you cannot give to other people. So make sure that you have enough food to eat. Make sure that you have enough oxygen to breathe. Make sure that you are drinking water, that you're taking your vitamins, that you're going to the bathroom when you need to. You don't push it off till like 45 minutes after you need to go because somebody else needs something.
Right.
Take care of yourself first, and
Hmm.
then you will go a lot further to help care for other people.
Exactly, exactly. You'll have more energy to put into caring for somebody else, and you won't be so angry about it. Because, like, a lot of
Correct.
times you get this burnout, and it's this thing where you just don't want to do it another day, and you're angry because you have to. You have no
And
choice.
resentful.
Yeah, resentful. That's a better word. And, as long as you're taking care of yourself, that resentment won't get so high, and sometimes
Correct.
it won't even show up. If you're caring for yourself well enough, you won't get to that resentful place, you know. Right, yeah. Um, I have one more story that I want to tell about when I was working restorative. So this man had a stroke, and it was a real bad one to where he was not able to eat properly. He had to have thickened liquids and pureed foods, and the thickest you could get of the liquids. Couldn't
So the
move.
thickest you could get of liquids, what she's talking about is like pudding consistency,
Right.
so that the person can swallow more
Right.
easily. Okay.
He couldn't walk. He couldn't use his hands. He literally couldn't move. It was almost like he was paralyzed. He wasn't paralyzed, but he
Hmm.
just couldn't move. And he had been going through physical therapy trying to get back the strength to be able to move and learn how to eat again. His insurance ran out. So he came to us, and every single day he came down to our restorative room. We had it set up for a bunch of different things. Well, he would have to come down for every meal, so we would help him eat, and we would help teach him how to eat again. We had the braces, we had assistive devices like the silverware that was like really fat, because he couldn't hold his fork the way you and I do to eat, right? So he needed something really thick, so he could put his whole hand around it and feed himself. And we started that way. And it took a lot, but we taught him different techniques to swallow things easier. We got his liquids down to regular liquids. We got him to where he could eat regular food again. We worked on all of his muscles throughout his whole body, and we got to the point where we were teaching him how to walk again. And
How old was he again?
I want to say he was in his 60s around this time, possibly 70s, but I want to say he was 60s.
So he still had some life to live.
Yeah, yeah, and he had the desire too. He had a huge family, and they were so loving. He always had family there, and they were amazing people. I loved them. They had a family restaurant, and his daughter was now the owner of it, and it was located in Lyons. And he used to always just rave and rave about this restaurant. So when we got him to the point where he could walk with a walker. Not all the time, for short distances, you know, but he could do it. He
That's
could,
huge, though.
yeah,
That's
it was
awesome.
ginormous. So he tells us one day, me and a couple of the other girls in restorative, he says, ladies, he says, I am so grateful for you guys. You guys have changed my life. You gave me hope and you actually got me there. He says, I want to do something for you. And we're like, oh, you don't have to do anything for us. You know, just seeing you smile is enough. And he
Right.
says, no, 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 no. He goes, I want to take you guys to dinner at our restaurant with my family.
Hey, that's cool.
Yeah, and so we made this plan to go have dinner at the restaurant. And now his family didn't know. He didn't want to tell his family how far he had gotten with the walking because he wanted to surprise them at this dinner, right? So me and the other restorative girls took him to the restaurant. By the time we got there, his whole family was there, and it was so great. It was so cool because they were all waiting outside the restaurant. They were lined up along the sidewalk by the in front of the restaurant. So we got there and we get him out of the car, and you know, he's getting out using the walker, and everybody's cheering him on, and they thought we were going to put him in the wheelchair. Well, he starts walking. And everybody was like, "Oh my god." And they were so happy, and now they were really cheering loud. They were screaming and laughing and hooting and hollering and crying. They were crying. And he walked into the restaurant and just, it was so emotional. I'm going to start crying now. But
That's
they were
amazing.
amazed that he was able to walk. And it was just such a happy time. And it was just so amazing.
It must have been gratifying to know that you helped with that, to know that
Yeah,
you gave a little bit of something to help a man walk
it
again. That's
really
amazing.
was. Because, and to this day, that's like my proudest moment. It really is. God, I gotta stop crying. My mascara's gonna run. I'm trying not to wipe my tears.
It's
Absolutely, yeah.
I think it's amazing that both of us have been through so many things, so many experiences working with other people and caring
Yeah,
for people, and I feel very blessed to have had the opportunity to do that
me too.
and to learn my craft under you, like under my friend who taught me to do it with compassion and expediency at the same time. Compassion and speed.
Yes. Get
Anyway, I'm so
that
grateful for you,
done.
and I'll that's right. Bop, psh,
That's right.
my little whip cracker.
Yes,
Anyway, it was
too.
my heart goes out to caregivers that are in the
Mhm,
trenches right now because I know what
yeah.
it's like. I'm just sending you my love and my energy and my
Mhm,
encouragement. You got this. You can do it.
mhm.
5 minutes at a time, right?
That's right,
Tori,
5
that's what we
minutes at a
talk about.
time.
5 minutes at a time. Get through the
That's
next
right.
5 minutes.
Yeah.
And then about it being years or
And take care of yourself. Please,
yes.
please, please take care of yourself. And in fact, speaking of that, we have a link for you guys. And we're gonna, it's a resources for caregivers. And it's got all sorts of really great resources all about caring for yourself as a caregiver. Um,
Right.
and then Taryn, don't you have some tips for people who know caregivers and what they can do to help them out and
Yeah, you
care
know
for
what? I
them a
was
little
kind
bit?
of one of the things that we wanted to kind of remind people is that if you know of someone who's in a caregiving position, you can help them make their lives a little bit easier. So some things you can do to support somebody who's in a caregiving role. You can bring them a meal, sign up for and in fact, being the person who sets up the meal train,
Mm-hmm.
huge. Be the person
Definitely.
who sets up the meal train for all the friends and sends out the
Mm-hmm.
emails to everybody. Be that guy.
Mm-hmm.
And then be the guy that signs up to bring a meal.
Right.
Okay. And it doesn't have to be anything fancy. Okay. We all appreciate not having to cook.
Yeah.
So bring some fried chicken and some mashed potatoes and whatever is easy for you. Bring that.
Mm-hmm.
And but show up with the food and give it to them because that feeling of receiving food, of
That's
receiving
love.
the comfort of not having to cook that night or clean
Right.
up that night is huge. It's
Yeah.
such a relief. So bring
And
food, laundry or dishes, show up at the house,
don't even ask, just do it.
just do it.
Yeah.
I'm never going to argue with anybody. If you guys want to come do my dishes, you just help yourself.
That's right.
You don't have to ask me permission
I
ever.
got some right now if you want to come.
You
Come
can
on
just go
over.
right in my kitchen, help yourself to the dish soap. It's like however much you need, you just get those dishes done. That's perfect.
Yeah.
Okay, so running errands is another thing. Like if you can help the person go to the grocery store and pick up a dozen eggs or whatever and help them not have to do that, that's huge, right? Shoveling snow and raking leaves and all the things like, oh man, like what a
Clean the
relief to not have
yard.
to do that 2-hour job. Get them a gift card for a delivery, you know, like,
DoorDash.
man, $25 for a DoorDash
Yeah.
saves you a whole dinner and night of dishes. Hell
Yeah.
yeah. That's amazing.
Mm-hmm.
Anyway, so that also, you know, whenever you're taking care of someone who is a caregiver, you should encourage them to take care of themselves, like I
Right.
just talked about, you know, like encourage the caregiver to
Have them
take a
go
break.
get a manicure. Tell them, hey,
Right.
you should go get a manicure. In fact, that could be one of your gifts. A gift
Right.
card for a
Give
manicure
them a
or a
gift of a
massage.
massage. Right.
Mm-hmm.
30 minutes off to take care of themselves
Yes.
or whatever brings you joy.
Go take a bath. Take a bubble bath, you know?
Take a bubble bath, read a
Here's
book,
some
take a
bath
nap.
bombs. Go take yeah, take a nap. Anything.
I remember as a new mother just feeling like I never got any sleep at all, you know.
Yeah. Oh, and that's the other thing too I wanted to mention, you know, it doesn't even just have to be someone you know is exhausted, because a lot of caregivers are really good at hiding that in front of other people. I was one of
Right.
those. You know, nobody understood or realized that I was getting burnt out, you know. If you know somebody's a caregiver, if they're working at a facility, if they have a family member at home or their kids even, you know, just do these things because you know they need it and you know they'd appreciate it.
Amen. Great idea.
Yeah.
So on that happy note, I just wanted to say thank you all for joining us on this journey. If you know of a caregiver out there, please give them your love and your support. Make sure that they're not alone. Make sure that they know that they have your support and that they have resources available to them.
We'll leave the links will be in our show notes.
Send us a note. You know, we'll be happy to kind of write you back and just let you know.
I'm real good at listening, you know.
Yep, me
and if
too.
you need any, you know, tips, advice, anything, you know, I'm more than happy to help you out in those categories too.
A virtual hug, man, we're here for you.
In fact, here's one now. I'm hugging you. I'm loving
from both
you.
of us.
And I'm appreciating everything that you do.
Back at you, baby. Happy travels, everyone.
everyone.
Happy travels indeed.
Mwah.